What it makes me proud of my profession is mainly that I can help people, mainly that I can give them a hope, mainly that I can work with them. I enjoy what I do, and at the same time, I give love to my patients in multiple ways. The most important way is healing them.
Well, long as I remember, I have cavities of my teeth. My new teeth was coming out. They was already rotten. And when I was 16 years old, I was on dentures.
I had had everything done that could be done orally prior to coming here, including implants, bridges, partials, root canals, everything. And I had a series of bridges that failed over the years and I had redone. And then when we moved to Dallas 2 years ago, a bridge failed.
It's been traumatizing my whole life, my teenage years. I lost my smile. Sorry.
I have always the passion to help patients that they don't have any more hope, and study the case very deeply and tell them, listen, you have another option, you have hope.
Well, there was significant cost, and I always had hoped that that last cost would be it, and of course it wasn't. When I look back on it now, I've spent $50,000, $60,000 over the years in procedures that have ultimately failed.
He had multiple work done before. He spent a lot of money in his mouth before, trying to get the best smile that he can get, because his work requires for him to have perfect teeth and be a great communicator.
The moment I walked in, I was treated very graciously. Dr. Pedro, Franco, told me that he wanted to treat me like his own father.
So that's the reason that I offered to him the BiteLock, because I think that was the best option that he can afford, and at the same time the best option that will give him the amazing results that he's experiencing right now.
When I first met Dr. Franco, I was all heartbroken, and I remember crying.
She came and she looked at me and she said, I know that you don't want to treat my case. I think that you maybe don't think that you can treat me. I don't want bone grafts, I don't want anything else like that. I just don't think that I have hope.
I just looked at him and I asked him a straight question. Will you take my case? Is there hope for me? And he told me yes. And he said, yes, I will take your case.
Sophie was with new hope. And the main reason was because I told her that she could be a perfect candidate for a BiteLock. So we told her, Sophie, I can restore your functionality, I can give you teeth, and I can do everything the same day.
I have no word for it, but I have self-confidence. I got my smile back. The difference between dentures and BiteLock is like day and night. It's amazing.
It was very reassuring to have it all done in one day, and it felt good to leave that day with the procedure finished at one time. Now that it's finished and the numbness is gone and it feels like me, it feels like nothing's ever been done, and it's just so reassuring that this is it for life now.
If you have to do something right, do it right. Pain always comes and leaves you, and what it comes after the pain is the most beautiful thing you ever see. You knew you